So what we're going to explore now is a deep dive into country offices in fundings and recommendations that we have put together. And so this part includes funding specifically from interviews with adolescents and key informant interviews around perception of child protection risks and safety. And those results include also the results from child protection risks scaling exercise that was held by each organization staff. So thank you, Dina, for deep diving in Bangladesh. So we start with Bangladesh, specifically with Cox's Bazar, where child protection risks and child protection needs remain very high. The most common child protection risks that were identified by Plan International and World Vision include child marriage, intrafamily conflict, and poverty as actually one of the main root causes that lead to all the child protection risks. The condition of the crisis, along with the overcrowded camps and socioeconomic challenges, has brought in the last years to a continuous and protracted increase of these child protection risks. What we see here is a combination, as I said, of results from child protection risk collected with adolescent taking from an interview and the staff. What we found interesting was that child marriage was always unfortunately at the first place, both for the staff and for key informant interviews and for children. It's a significant concern that affects mostly girls. And this is given by the limited access to services and opportunity for births, combined with camp poverty, lack of registration, the specific political context, and child marriage is perceived as sometimes as the only way to alleviate poverty and escape from sexual exploitation. Child labor is also prevalent and strong, particularly among boys due to economic needs within the camps. Boys as young as 10 are often exposed to work and the need to contribute to family income. This can lead to exploitative conditions, has also led to drug use and sometimes involvement in criminal activities. On top of that, there were reflections around children with disabilities and the fact that they face widespread discrimination with a lack of infrastructure to respond to their needs, lack of services, and lack of support available to them in the camps. In terms of safe spaces, what the children perceive as safe is the home, schools, mosques, and hospitals, while riverside, forests, and refugee camps as a whole are considered as unsafe places. Recommendations that raise are specifically around child marriage and support to those that are already married, support families to help prevent child marriage through improving material condition or cash when possible, and considering few opportunity to access safe livelihood for boys and girls after school. We are aware that the context doesn't make it easy, but this is the recommendation that is mainly given by the key informant interview adolescent and the staff. Next slide, please. Thank you. We deep dive now in Burkina Faso, where Terre des Hommes Suisses focus on child-friendly spaces and child protection intervention, including community-based intervention in the center north of Burkina Faso. And they collaborate with local communities and authorities, emphasizing integrated approaches, while Child Fund operates in the Sahel region, addressing food security, malnutrition, working through emergency response, PSS activity, and cash assistance. Given the context, not anymore of cash assistance, but the plan was to work in cash assistance in Djibo and Gorongoron. The ongoing political crisis and armed groups attack have actually led to significant displacement and child protection risks in Burkina Faso. The quantitative data have highlighted that the most common child protection risk found by Terre des Hommes Burkina Faso is neglect, poverty as root causes, and intrafamily conflict and teenage pregnancy. For child fund, Burkina Faso, the most common risks are neglect, child marriage, and violence, specifically physical violence. Qualitative funding from the zone, as I said, indicates poverty as root causes, but also integrates consequences as early pregnancy, family separation due to armed conflict, abuse of drug or alcohol among adolescents in the region of Center North. While child fund qualitative data from the Sahel region emphasize strongly the use of violence against children as one of the main risks. So recommendations from Burkina Faso are actually around constructing a protective environment for children at family level, and this includes the fact that separation can be prevented, but also family and caregivers can provide a safe environment for children despite the conflict. Reducing child labor and school dropout has also been identified as essential child protection risk to be tackled in collaboration with education actors and with all other humanitarian actors present in the area of work. Let's go to Central African Republic. Next slide, please. Thank you. In the Central African Republic, Plan International operates in the sub-prefecture of Bria, and SOS Children operates in Bosango area. Both organizations identify neglect, violence, and child marriage as common child protection risks. SOS Children also highlight teenage pregnancy and consequent parenthood as a significant risk. The country faces widespread poverty and violence due to years of conflict, resulting in compromised services, security, and infrastructure that still result being very weak. And so access to health, sanitation, and food security still remain precarious. And those are, once again, the root causes of child protection risks. Children in the community where SOS International work are often exploited through worst form of child labor, particularly in diamond mining. They have restricted access to school opportunities, and unfortunately, they often incur in an economic burden. Going back to the mining sites, we know that the mining sites are also, protract a worst form of child labor, but they also are sites of physical and sexual violence, and also sites where rebel and armed groups often control and then expose children to recruitment. Sexual and gender-based violence is also prevalent, stemming to the results from SOS and Plan International, even if those are often underreported, given to the limitation of access to the justice system and lack of trust. So it's often left discussed within the community itself, but it is perceived as prevalent. In terms of recommendation, there are strong recommendations around considering child labor and child marriages as priority, especially when it comes to working with the education sector and livelihood. Furthermore, there was a focus and suggestion to work on in preventing intra-family conflict and promoting positive parenting activities to make sure that caregivers and families can ensure a protective environment for children. Next slide, please. Thank you. About Colombia, so you might excuse my pronunciation in Spanish. SOS Children Village operates in Chocó in the West Pacific and near the Venezuela border. They work with host community, forced displaced migrants from Venezuela, indigenous communities, and African descendant communities. Zone works in Buenaventura, Cali, Norte de Huaca, and Valle de Huaca in the west of Bogota, collaborating with NASA indigenous community in area facing recurrent incursion by irregular armed groups. And this is a very important information actually when we analyze child protection risk. Common child protection risks identified by SOS include neglect, violence, teenage pregnancy, and consequent parenthood. Similarly, child protection risks identified from the zone include violence, neglect, intrafamily conflict, teenage pregnancy, and consequent parenthood. In the report, substance abuse of substance and conflict with the law and migration have been identified as additional issues leading to children vulnerability all along with child recruitment. And specifically for indigenous communities, child labor and teenage pregnancy have been identified as main issues. General recommendation in the case of Colombia include focusing on gender-based violence, protecting children from sexual violence, and these include girls and boys, and address indigenous and non-indigenous divides through analyzing better what are their views and thoughts, the gender norms and the harmful practices that actually affect them specifically, and how those are perceived by those groups. Next slide, please, Ethiopia. Thank you. So, Child Fund and Save the Children in Ethiopia work in the Mara region to address child protection challenges due to a conflict and economic hardship that affect the population that have been affecting the population for the last years. The baseline data reveals that Child Fund identifies neglect and intrafamily conflict on top of physical violence as the most common child protection risk. And similarly, Save the Children recognize neglect, physical violence, and child marriage as prevalent concerns. Children's perception of safe and as unsafe space includes infrastructure, schools, and the family household. Unfortunately, there is an extensive damage to health infrastructure, schools, and there is a huge loss of livelihood and displacement that have increased during the year sexual violence against women and girls in this specific area. In terms of gender-based violence, child marriage, teenage pregnancy remain very high, as specific GBV and harmful practices, but child labor as well have been identified as one of the issues on the rise. And this is given by the economic hardship that has been identified as a root cause, normalization of child marriage, and loss of faith in girls' education prospects. In the light of these challenges, the report suggests that improving economic capacity within community is actually a crucial strategy for enhancing child protection, and this might target both families or children out of school. It is essential to mitigate the negative impacts of child labor and early marriage, and allied collaboration with other international agencies, with CSOs, implementing partners, and clusters. And once again, specific attention should really be paid around sexual and gender-based violence, including issues of child marriage and teenage pregnancy. And finally, we will go to South Sudan now. We explore the results the Save the Children and World Vision have shared with us. So in South Sudan, as you know, this country has faced pressing challenges due to conflict and violence in the last years, and reports indicate widespread displacement, serious abuses, and recruitment of children into armed groups. So Save the Children operates in Bor State, Akobo, and Wagak, where they've established child protection intervention, including child protection prevention and response activities, including child protection at desk. World Vision works in Tambura and Juba counties in the central Equatorial State and western Equatorial State. They focus on health, nutrition, child protection for the two regions. Both Save the Children and World Vision have included and identified child marriage neglect as main risks, with a slightly different of identifying abduction and trafficking for Save the Children and physical violence where World Vision work. The presence of armed groups contribute to abduction of trafficking, especially in jungle, and separation from family in the Equatorial State. The baseline underscores the urgent need for comprehensive intervention in South Sudan in the different regions, especially due to the challenging and conflict-ridden environment. Recommendation includes strengthening the existing support networks that already exist and have been identified as essential to prevent and respond to child protection risks. Once again, special attention should be given to girls in child marriage and other forms of gender-based and sexual violence. In South Sudan, these risks are strongly exacerbated by worsening of the food security situation and lack of access to material or to psychosocial well-being services. And this should be really enhanced by child protection actors, community, families working in the region where Save the Children and World Vision are now. So going to the final recommendation, there are, next slide, please. So there are many recommendations that actually can come out from this presentation, but we decided to pull up 4. If you have many others that come from your reflection, please don't hesitate to share. The first one, it's around actually the use of cash and voucher assistance when possible, or the form of assistance. As we said before, Burkina Faso is a special environment, so this it needs to be adapted to the context. But what we want to state here is that include viability of tailored small-scale cash transfer to respond or to prevent to child protection needs and risks may really help to contribute to the well-being of children. So we are really happy that one of the activities in this consortium is provision of cash and voucher assistance. It's really important. This type of assistance goes in promoting children's well-being. Number 2, fighting gender-based violence against children. This was an unfortunate line that we kept from Bangladesh to South Sudan. Child marriage, gender-based violence are so prevalent in all the countries, and they lead to early pregnancies where they really need to be considered as priority when working with girls and boys. This might include, actually this must include analysis of gender norms, of attitudes and behavior, perception when possible, and engaging actively with girls to create activities and integrate comprehensive support for girls. The third recommendation is to the Technical Project Committee. There are so many fundings here, and there is so much that is done by the consortium, and this consortium represents such a potential that actually fundings, innovation, and lesson learned can be both discussed and raised in the Technical Protection Committee. And finally, on the midterm review and the final evaluation, we suggest that lesson learned and good practices per result area are actually brought up by the countries and by the partners, so that next phases or future phases can actually be done in a better way with a higher impact on children and adults.